السلام عليكم ورحمة الله وبركاته. مع تمنياتي بالسلامة للجميع إن شاء الله. My lecture is a single complete denture presents by Prof. Dr. Ragda Karim Jassim, Head of Prosthodontic Department, College of Dentistry. A single complete denture, it could be either a single complete denture opposing natural teeth or a single complete denture opposing previously constructed complete denture. In case single complete denture opposed by natural teeth, it is either upper complete opposing by complete mandibular dentition or upper complete opposing by mandibular partial denture or lower complete denture opposing by upper partial denture or lower complete dentures opposing by complete maxillary dentition. It could be a single complete maxillary denture opposing all or some of mandibular natural teeth. This case of upper single complete denture opposed by natural dentition, it is the very common clinical situation. يعني in dental clinic, most common cases among patients is upper single complete denture opposed by natural dentition. Maxillary, what is the problem of this case of maxillary complete denture opposing by complete mandibular dentition? From the picture presents, you see here that there is an irregularity presence in the natural dentition. This means there is an occlusal discrepancy. Is the main problem of upper maxillary single complete denture opposed by natural dentition. So before constructing a complete denture opposed by natural dentition, and since there is a problem of occlusal discrepancy, so the start point with this case is by a proper evaluation for this occlusal discrepancy from diagnosis of this case, and it need to do a modification or corrections for these occlusal discrepancies. Occlusal surface or by crown and the bridge. So before doing corrections of this occlusal discrepancy, several techniques could be used to determine the occlusal modification that are necessary prior to denture constructions. And these techniques are first Yarkastas technique. In this technique, where the patient has an upper complete denture opposed by lower dentition, Yarkastas technique proposed the use of U-shaped metal adapt to the occlusal surface of the lower arch, so the area of occlusal discrepancy of high spot, it will attach to the metal frame. So this area will need for a trimming or removal until obtain all the teeth contact to this U-shaped metal. As you see here, that this is the picture of U-shaped metal used by Yarkastas technique, and this adapt to the occlusal surfaces of the lower teeth of the patient. So you see here that this tooth, natural tooth, is not in contact with the metal framework, or this lower cast. When this metal frame is adapt to this occlusal surface, you see that the occlusal plane of the lower teeth was curved, while the upper it is not complete contact with the metal framework. So this case is has an occlusal discrepancy, so it need corrections for this occlusal discrepancy before start doing a complete. Second technique is Swinson's technique, and this technique it depends on the use of articulating paper adapt to the occlusal surface of the cast opposed by complete denture, and then the area of high spot it will determine, and the next step is removal of this high spot from the cast. And then the area which need removal of the high spot was marked by red line, and then intraorally inside the patient's mouth it need removal of these high spots in order to obtain and remove equal contact between all natural dentitions and remove the high spot. Third technique is a bruise technique. This technique depends on the use of a clear acrylic resin template fabricated over a modified stone cast. Then the inner surface of template is coated with a pressure indicating paste and placed over the patient's natural dentition. So any pressure area, it will appear that the tooth come in contact with this acrylic, clear acrylic. This means that this tooth has a high spot or need modification, and we will continue correct this condition until no pressure area show through the template.